Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Good day, everyone. Today, let us look at anger from a different angle. Do not treat anger only as a moral weakness, a personality flaw, or a lack of discipline. Look deeper. Ask this first. Why does the nervous system become so quick to ignite? How does a small comment become a large reaction? Why does the body sometimes behave as if it is under attack, even when the situation is ordinary? Anger is not only an emotion, it is also a biological event. It involves the brain, hormones, sleep, inflammation, blood sugar, pain, fatigue, and the way the nervous system reads threat. So if we want better anger control, do not only say, calm down. Say instead, strengthen the body that is being asked to stay calm. That is where vitamin D becomes important. Now listen carefully. Vitamin D is not a sedative. It is not an anti-anger pill. Do not use it as a replacement for therapy, communication skills, psychiatric care, or emergency help when anger becomes dangerous. But do respect it as a biological support system. Vitamin D behaves less like a simple vitamin and more like a hormone-like regulator. It helps manage calcium balance, immune signaling, muscle function, and brain-related pathways. The National Institutes of Health describes vitamin D as a nutrient made through sunlight exposure, obtained through foods and supplements, and activated through the liver and kidneys before it performs its work in the body. Vitamin D receptors have also been identified in neurons and glial cells in brain regions involved in mood regulation. So ask, how could something connected to sunlight, bones, immunity, and the brain influence anger? Why would a deficiency in this system make emotional control harder? Let us build the answer step by step. First, understand anger as a threshold problem. Imagine the mind as a room with a smoke alarm. A healthy alarm detects real danger, but an oversensitive alarm screams when toast is slightly brown. Many people with poor anger control are not bad people. Their alarm system is set too low. They react before they reflect. They defend before they understand. They explode before they can choose. So do this. Stop asking only, what made me angry? Also ask, why was my threshold so low today? Was I tired? Was I inflamed? Was I in pain? Did I sleep poorly? Did I skip meals? Am I deficient in something that helps the nervous system stay stable? Vitamin D enters here because low vitamin D status has been repeatedly associated with mood difficulties, depressive symptoms, and behavioral dysregulation in different populations. The evidence is not perfectly simple. The NIH notes that low 25-hydroxyvitamin D has been associated with depression risk, while clinical trials have produced mixed results. That is important. Be honest with the evidence. Do not oversell it, but also do not ignore the biology. Mixed evidence does not mean meaningless evidence. It means we must apply it carefully, especially in people who are low, at risk, or symptomatic. Now ask, why would mood matter in anger control? Because anger often rides on top of low mood. Many people do not say, I am sad. They snap. They criticize. They become impatient. They withdraw, then erupt. In clinical practice and daily life, irritability can be the louder face of emotional strain. If vitamin D support improves low mood in some people, it may indirectly reduce the emotional pressure that feeds anger. Recent meta-analytic literature has continued to examine vitamin D supplementation in adults with depressive symptoms and depression. Some newer randomized trial meta-analyses report benefits, especially when vitamin D is used as an adjunct rather than as a standalone cure, while older or broader reviews have been more cautious. That contrast matters. It tells us to be precise. Vitamin D is most reasonable as a supportive correction of a biological vulnerability, not as a universal emotional treatment. Second, look at serotonin. Ask yourself, how does the brain create emotional braking power? How does it stop an impulse from becoming an action? One pathway involves serotonin, a neurotransmitter deeply involved in mood, impulse control, stress tolerance, and aggression regulation. The relationship is not cartoon simple. Serotonin does many things in many brain circuits. But the broad point is this: when emotional regulation systems are strained, anger can become faster, sharper, and less controllable. Research has explored vitamin D's relationship with serotonin biology. A systematic review and meta-analysis evaluated whether vitamin D supplementation affects serum serotonin levels, and mechanistic literature has discussed vitamin D's role in pathways related to serotonin synthesis. This does not mean vitamin D simply creates happiness. Do not think that way. Think more accurately. Vitamin D may help support the biochemical environment in which emotional regulation systems operate. So give yourself this command. Do not wait until anger reaches the mouth, the fist, the text message, or the slammed door. Support the system before the trigger arrives. Third, consider inflammation. Why does inflammation matter? Because an inflamed body can produce an irritated mind. When inflammatory signaling rises, people may feel tired, foggy, restless, sensitive, and emotionally raw. The brain does not float above the immune system, it listens to it. Vitamin D has been studied as a modulator of immune and neuroinflammatory pathways. A 2024 review described vitamin D acting through receptors in glial cells and influencing pro-inflammatory cytokines and antioxidant systems, with implications for neurological and psychiatric conditions. Again, be careful. This is not magic, but it is meaningful. If the brain is receiving inflammatory noise, anger control becomes harder. If vitamin D status helps quiet part of that noise in vulnerable people, the person may gain a little more pause between feeling and reacting. Ask, what is anger without a pause? It is reflex. Ask, what is anger with a pause? It becomes information. That pause is precious. Protect it. Fourth, look at direct behavioral evidence. There is research specifically connecting vitamin D status with aggression-related outcomes. A review on nutritional factors associated with aggression reported that low vitamin D status has been linked in observational studies to more aggression in adolescent girls, and that children with higher serum 25-hydroxyvitamin D showed moderate declines in externalizing behavior, including aggression and conduct problems, over 12 months. The same review also reminds us that supplementation trials are limited and not always positive, which is exactly why the best message is balanced. Correct deficiency, support regulation, and combine it with behavioral skills. A nationally representative adolescent study from Iran examined vitamin D deficiency in relation to psychiatric distress and violence behaviors, including anger-related measures. It discussed serotonin as a regulator of stress, anger, depression, aggression, appetite, and behavior. That does not prove that vitamin D deficiency causes every anger problem, but it does tell us something important. Emotional control belongs to the whole body, not just to willpower. Older adults show a related signal too. In the CLIP study, vitamin D deficiency was associated with more severe agitation and aggressiveness and disinhibition subscores among older adults. Different age group, same lesson. When the brain is vulnerable, biological deficits may appear as behavior. So say this clearly to yourself and to anyone you guide. Do not excuse harmful behavior, but do investigate the biology beneath it. Accountability and physiology can stand in the same room. Fifth, understand fatigue and pain. Why do tired people get angry faster? Because self-control costs energy. Patience is not free. The prefrontal cortex, the part of the brain that helps us stop, evaluate, and choose, works poorly when the body is exhausted, sleep-deprived, or physically uncomfortable. Vitamin D deficiency can contribute to muscle weakness, cramps, fatigue, bone pain, and low mood in some people. Cleveland Clinic notes that severe vitamin D-related calcium and parathyroid disturbances can cause symptoms such as muscle weakness, cramps, fatigue, and depression. If a person is living with low-grade physical discomfort every day, anger may become the language of depletion. Ask, how patient are you when your body hurts? How gentle are you when you are exhausted? How controlled are you when your sleep is poor and your muscles feel heavy? Now act. Check the foundations. Do not build emotional discipline on a depleted body. Sixth, apply vitamin D wisely. Do not rush to high doses. Do not copy someone else's supplement routine from the internet. Do not assume more is better. Vitamin D is fat-soluble and excessive intake can cause harm, especially through high calcium levels. The NIH lists adult tolerable upper intake levels and explains that too much vitamin D may lead to toxicity. The Endocrine Society's 2024 guideline also emphasizes that healthy adults under 75 generally should follow recommended daily intake rather than automatically taking higher amounts, while certain groups, such as children, pregnant people, adults over 75, and adults with high-risk prediabetes, may need different guidance, so use this practical sequence. First, identify your risk. Are you indoors most of the day? Do you live in a northern climate? Do you cover most of your skin outdoors? Do you have darker skin? Do you have obesity, malabsorption, liver or kidney disease, or take medications that affect vitamin D metabolism? Are you older? If yes, take this seriously. Second, speak with a clinician when risk is high or symptoms are persistent. Ask whether a 25-hydroxyvitamin D blood test makes sense for you. Do not demand testing as a ritual. Use it as a tool when the clinical picture supports it. Third, use food and light intelligently. Get safe sunlight exposure when appropriate. Add vitamin D containing foods, fatty fish, fortified milk or plant beverages, fortified cereals, egg yolks, and mushrooms exposed to ultraviolet light. Do not make this complicated. Make it repeatable. Fourth, if supplementation is appropriate, take it consistently. Many adults use vitamin D3, often with a meal containing fat, because absorption can be better with dietary fat. But again, choose dose with medical guidance, especially if you have kidney disease, high calcium, sarcoidosis, certain lymphomas, or take medications that interact. Fifth, track anger like a clinician, not like a judge. For 8 to 12 weeks, write down 3 things: your sleep, your anger intensity from 1 to 10, and your recovery time after irritation. Why recovery time? Because the goal is not to become emotionless. The goal is to return to control faster. Sixth, pair vitamin D with behavioral commands. When anger rises, say, stop, breathe, lower your voice, relax your jaw, unclench your hands, delay the message, leave the room safely, drink water, and return when your body is calmer. Ask, what am I protecting right now? My pride or the relationship? My ego or the truth? Vitamin D may help prepare the ground, but you must still practice the skill. Seventh, remember the deepest point. Vitamin D may improve anger control, not by suppressing anger, but by improving the conditions under which self-control becomes possible. How? By supporting mood pathways. How? By participating in serotonin-related biology. How? By helping regulate immune and inflammatory signaling. How? By reducing deficiency-related fatigue or discomfort in those who are low. How? By strengthening the body that the mind depends on. Why is that powerful? Because many people attack anger only at the final second, the moment of explosion. But by then, the nervous system has already loaded the weapon. Work earlier, work deeper, work daily. So let us conclude with a clear message. Do not think of vitamin D as a cure for anger. Think of it as one part of emotional infrastructure. If anger is the flame, vitamin D may help reduce some of the dry material around it. Low mood, fatigue, inflammation, and poor nervous system resilience, especially when deficiency is present. Ask better questions. Why am I reacting so quickly? How is my body influencing my mind? What can I correct before I apologize again for the same explosion? Then act. Check your risk. Get sensible sunlight. Improve your diet. Use supplementation only with wisdom. Track your reactions, practice the pause, protect your relationships, and remember, anger control is not about becoming cold. It is about becoming strong enough to stay kind while under pressure. Take care of yourselves, take care of one another, and let us keep growing together like a family. I'll see you in the next topic.